Detailed explanation with memory aids and organization for medications and treatments. 1. Conditions, their causes, and treatments. 1.1 Eczema. Definition. Eczema, also called atopic dermatitis, causes itchy, red, dry patches on the skin. Imagine sensitive skin overreacting to environmental irritants or allergens. Causes: genetics, allergies, skin barrier defects, or immune system dysfunction. Environmental factors such as soaps, weather, or dust can worsen symptoms. Symptoms: itchiness, sometimes extreme, redness, cracks in the skin, and occasional clear fluid oozing from affected areas. Treatment: 1. Cream Clobet, Eclobet N, Bet-CG. Purpose: topical corticosteroids that reduce skin inflammation. Dosage: apply 2 to 3 times a day on affected areas. Precautions: avoid long-term use to prevent thinning of the skin. Visual: think of cream dousing the fire of inflammation. 2. CAP, Flugel 50, fluconazole. Purpose: antifungal for skin fungal infections. Dosage: once daily for 1 to 2 weeks. Mnemonic: Flugel fights fungal foes. 3. Tab Filmet 400, metronidazole. Purpose: broad-spectrum antibacterial to prevent bacterial superinfections. Dosage: take after meals to minimize a metallic taste. Side effects: mild nausea, reinforced with fluids to prevent dehydration. 4. CAP, Fluclox 500, flucloxacillin. Purpose: antibiotic to treat deeper bacterial infections linked with eczema flare-ups. Dosage: regular doses over 1-2 weeks. Mnemonic: Fluclox fights flares. 5. Pantid 20, pantoprazole. Purpose: protects against stomach irritation caused by antibiotics. Dosage: take 30 minutes before meals. 1.2 Allergic Rhinitis. Definition: chronic irritation and inflammation of the nasal passages due to allergens. Causes: allergens such as pollen, pet dander, and dust trigger a hyperactive immune response. Symptoms: sneezing, runny nose, nasal congestion, itchy nose or throat, watery eyes. Treatment: 1 tab, Ebastin 10 mg. Mechanism: antihistamine reduces allergy symptoms by blocking histamines. Timing: take at bedtime to counter possible drowsiness. Mnemonic: Ebastin eases every allergic experience. 2. Tab Cvit 250, vitamin C. Use: enhances immune response and soothes allergies. Mnemonic: Cvit keeps colds and congestion at bay. 3. Antizol nasal drops. Purpose: reduces nasal swelling to provide quick relief from nasal blockages. 4. Ingen Fluvax Tetra IM. Purpose: flu vaccine to reduce the risk of seasonal flu worsening allergy symptoms. Top 1.3 Epistaxis, nosebleeds. Definition: bleeding from the nose due to trauma, dryness, high blood pressure, or clotting disorders. Causes: dryness of nasal membranes, common in winter. Trauma, nose picking or accidental impact. Underlying conditions: high BP, clotting disorders, or infections. Symptoms: visible bleeding, usually from one nostril, sometimes accompanied by headache or dizziness. First aid: 1. Pinch nostrils and lean forward, prevents blood entering the throat. 2. Apply cold compresses to constrict vessels and reduce bleeding. Treatment: 1. Traxil 500, tranexamic acid. Purpose: prevents blood clot breakdown and stabilizes active clots. Dosage: 500 mg IV stat in emergency cases, then oral tablets for stabilization. 2. Other investigations: ICT NS1 for dengue, rules out viral-induced bleeding. CBC identifies underlying anemia or infections. X-ray, PNS, checks nasal cavity for fractures, growths, or infections. General memory aids: use mnemonics like cream calms chaos for eczema creams or Ebastin battles sneezing. Link meds to their primary use, like Traxil for trauma-related bleeding. Practice with diagrams. Sketch a nose, throat, or skin to visualize how symptoms and meds interact. Would you like details on how medications work on a cellular level, or focus more on treatment durations and monitoring?